There are many different types of talk therapy, and in this segment we will discuss the major types of psychotherapy. First, though, I want to address the commonalities and differences across these types of therapy. First of all, what's really important in talk therapy, also known as psychotherapy, is a relationship between the client and the therapist. Basically, if you're looking for a therapist, you want to make sure that you find someone who you feel like really listens to you and understands you. That relationship is very important in any theoretical approach. All psychotherapies have generally common goals. They try to reduce the symptoms of mental illness and improve their clients' quality of life. Now, exactly how they do that is part of the differences. So one difference is who therapy is given to. Sometimes therapy is given to an individual, sometimes it's a couple, sometimes it's a family or group therapy. So that's one way of differentiating therapies. The other way is a theoretical approach. Some therapies are based on the assumption that once you understand, you gain insight into why you behave the way you do, why you react to things the way that you do, that insight will help you to understand yourself and your situation better, have more compassion for yourself, learn strategies to help you live a happier, more fulfilling life. Some therapies focus on changing your emotional reactions. Some therapies focus on changing how you think about yourself and your world and your situation. And other therapies focus just on changing your behavior, and they don't try to change your thoughts or your emotions. Those groups think that once you change your behavior, then changes in thoughts and emotions will come along naturally after the fact. Okay, let's start with Freud, because all psychotherapy starts with Freud. It was the first type of talk therapy, and Freud's big assumption was that therapy be used to help people understand memories of traumatic events that they may have repressed, things that they might be fixated on, issues that they may not have resolved in their childhood, conflicts from their childhood that may be still hampering them today. Psychoanalysis is based on insight. The idea would be that if you come to understand that you have some unresolved conflict from the past, that you can work on that conflict now and have better relationships in the future. And as you may remember, the tools that are used in psychoanalysis are many. Some of the big ones are free association. So instead of asking you what you think about your mother, a psychoanalyst might say, if I say the word mother, what's the first idea that comes into your mind? Remember, they're trying to work through the unconscious. Psychoanalysts also look at resistance. If they try to guide you to talk about a particular episode or problem, and you always resist talking about that episode or problem, a psychoanalyst will conclude that that resistance means that there's really tough stuff in there that you need to deal with. They analyze dreams, again, as a door to understanding the unconscious. They also think about patterns of transference. Remember when we talked about Rorschach techniques or the TAT? It's a psychoanalytic idea that you project your feelings and emotions onto other people. In psychoanalysis, the assumption is that you project your feelings and emotions, attachment styles from your past onto your therapist, and so you can work out transference issues. That was psychoanalysis. Next, I'm talking about humanist psychotherapy or humanist therapy, which is about as different as psychotherapy as you can get. Humanist therapy focuses on the positive aspects of being human and humankind, and it focuses not on childhood traumas, but more on current situations and current struggles. The assumption in humanist psychology is that we all have this need, this deep need to be accepted for who we are unconditionally. And so humanist therapists try really hard to get people to understand that they are valuable and that the therapist accepts the client for who they are. And that acceptance needs to be genuine and based on empathy. The goal of humanist psychology is to help people reach their fullest potential, the best version of themselves. Humanist therapy is not directed so much by the therapist. The therapist lets the person decide what the path is going to be through therapy. What the therapist does is empathize and very actively listen to understand what the person is dealing with. If you remember B.F. Skinner and John Watson, then you remember behaviorism. Behavioral therapy focuses on, again, changing your behavior, not on changing your thoughts or your beliefs or your understanding of old conflicts, just your behaviors. There are many different types of behavioral therapy. One of them is aversion therapy. If you have a habit that you don't like and you want to get rid of, then aversion therapy might be for you. So for example, maybe you want to stop smoking. Well, aversion therapists would say every time you feel like smoking, give yourself aversive stimulus, maybe a little rubber band that you snap so you have a flick onto your wrist. Here is a type of aversion therapy that's used to try to treat alcoholics. Here's what they do. They find a drug that produces nausea, produces vomiting. It makes someone sick. So if you take this medication by itself, you will vomit. Okay. What do they do with an alcoholic? They take the medication and they put it in the alcoholic's alcohol, so that every time the alcoholic drinks alcohol, they become sick. So eventually you get this association. If I drink alcohol, I'm going to get sick. If I drink alcohol, I'm going to get sick. And eventually you don't want alcohol anymore because you're tired of being sick. So that's aversion therapy, which tries to eliminate the bad, unwanted behaviors. Another type of aversion therapy is systematic desensitization. This is when you want to get rid of not behaviors, but reactions. So for example, if somebody is afraid of spiders, maybe they're phobic of spiders, what systematic desensitization therapy does is to get the person calm around spiders. First, the therapy starts off with maybe say, I'm the one who's afraid of spiders. Maybe I'd go into the therapist's office and the therapist might show me a toy spider on the opposite side of the room. And then the therapist would work with me to relax in the presence of the toy spider. So progressively, maybe meditate, maybe breathing exercises to get rid of the fear response. And then maybe in the next session, the toy spider would become closer, and I would learn to have a calm, peaceful reaction when I see the toy spider. And then maybe I would work up to an actual spider in a box, and that might be on the opposite side of the room. And I'd be afraid to see the spider, and then the therapist would work with me to be calm so I could see the spider and have a calm response, and the spider would get closer and closer. The picture that I show you here is a slide taken from desensitization therapy that's conducted in VR, virtual reality. So you can have someone work with a spider or be near a spider, or even have a spider walk on them in virtual reality. And at the same time that's happening, the therapist helps you to calm down. So what the therapist is trying to do is to stop the fear reaction every time you see the thing you're phobic of, the spider, for example. It's also very helpful for low cognitive functioning people, maybe folks with autism or some sort of learning disability or institutionalized individuals. If you are interested in working with children who have learning disabilities or autism, then you may want to become an ABA, an Applied Behavioral Analyst, which is someone who works with children using the techniques of behaviorism to help shape that child's behavior. So maybe you shape a child's behavior so that they raise their hands anytime they need to leave a classroom. Usually this involves tokens. If the child does something that you want and you want that behavior to be repeated in the future, then what do you do with behaviorism? You reward them. So that's another kind of behavioral therapy. Cognitive therapy is very different. It doesn't work on emotions, it doesn't work on behaviors, it works on your thoughts. So cognitive therapy tries to help people change the way they think about things. What a therapist will do is try to identify any irrational or maladaptive thoughts. So let's take the example of depression. Many times when people are depressed, they'll use very self-defeating language. And a lot of times that language involves absolute terms. Always, never, every time, everyone. So for example, instead of my boyfriend maybe left me for someone else, instead of just thinking that my boyfriend's not interested in me, I think that everyone on the planet doesn't like me. That's the sort of thinking that occurs in depression. And so if you work with a cognitive therapist, you work on breaking these sorts of reasoning, these sort of thinking that leads people from sadness into depression. So, maybe I've tried to go to graduate school and I've applied and I haven't gotten in, and that's made me sad. But if I conclude I'll never get into graduate school, no graduate program will ever want me. See, that's the sort of thinking that is illogical. It's just not true, but it's the sort of thinking that if you change, you can change people's emotions and behavior. I also want to tell you about a kind of mindfulness therapy. It's called dialectical behavioral therapy. And the idea here is to help people become mindful, become grounded, and to help them understand that, relationships are challenging and life is bumpy, and every time something goes wrong, you don't need to react in an extreme way. So in DBT, people work to tolerate distress. So for example, now during the pandemic, a lot of people are very stressed. They're feeling socially isolated. They're having to live and work and love in new ways, and that can be distressing. What DBT therapy would do would be to help people understand that they can feel unhappy, they can feel distressed, and it's okay. Those are just feelings. You don't have to act on them. Just recognize them, feel them for what they are, notice them, don't make judgments, that sort of thing. DBT also involves regulating emotional responses. So maybe I don't need to fly off the handle completely each time I don't get what I want. DBT also helps people manage their relationships better. So instead of jumping to conclusions about what somebody else is thinking or feeling, what a DBT therapist would help you to do is to understand that, okay, I see that my significant other is behaving in a particular way, but I don't actually know what they're feeling or thinking unless I ask them. So DBT therapy works for all sorts of people with PTSD, people with substance abuse, bipolar disorder, borderline personality disorder, people with eating disorders, to help us deal with the bumps and bruises that come with everyday life. What makes psychotherapy effective? Is it important to see someone who has a MD over a PhD, or a PhD over a PsyD, or a doctorate versus a master's? Turns out your therapist's degree does not really predict the success of therapy. The things that determine whether therapy is going to be successful are, number one, and this is the most important thing, do you feel heard and understood by your therapist? That is the relationship between you and your therapist really good? Do you think that your therapist understands what you're talking about? If so, great. If not, go to another therapist. Another important factor in determining whether therapy is helping is whether the client is motivated to change. Some people go to therapy because they know their life is a mess, but change is difficult, and so they work really hard not to change. They don't really want to change. Maybe they like their life being kind of chaotic. So people in therapy have to be willing to change in order for therapy to be effective. Therapists also need to be warm and empathetic. If you feel like your therapist is cold and judgmental, that's really going to make therapy hard. And it's important that the therapist uses the right technique for the issue you want to work on. You could see a psychoanalyst to stop smoking, but really behavioral therapy would probably be better. I've just mentioned lots of different types of psychotherapy. Is it important that you go to one type versus another? Actually, no. What's important is that you connect with your therapist and feel heard and understood. And in fact, a lot of therapists they pick and choose. They use different tools from all of the different kinds of therapy. How quickly does psychotherapy work? Here's a graph. If For those of you who are in the medical or biomedical fields, this is a dose-response curve. Basically, along the horizontal axis is the number of sessions of psychotherapy, talk therapy somebody has gone to. It starts with just 2 psychotherapy sessions and goes to 104. The assumption is you go to psychotherapy once a week, so 52 weeks would be a year, 104 would be 2 years. And along the vertical axis is the percent of improvement. And what I want you to see is that within the first year of psychotherapy, if you go to psychotherapy for a full year, 52 sessions, then 80% of subjects report significant improvement in their life, significant reductions in their symptoms, significant improvements in their quality of life after seeing a psychotherapist for a year. Now, it's true, 20% of people report feeling better after just 2 sessions, but the longer you go, the bigger the impact. Between 1 year and 2 years, you get another 10% of people who report feeling significant improvements. So the most rapid change, however, takes place during the first 6 months. You get the biggest impact in the shortest amount of time. It's really 6 months, that 26 sessions. Is psychotherapy effective? Yes, psychotherapy is effective. And here are 2 graphs to help explain how effective psychotherapy is. Let's say that first normal distribution that's orange colored, it's on the far right, that is the outcome of your average psychotherapy patient, the outcome in terms of how satisfied you are with your life. And the blue one is the average satisfaction, if you will, for somebody who hasn't gone to psychotherapy. And what I want you to see is if we look at the average psychotherapy client, the average there is greater than 80% of the untreated people. In other words, the average person who's gone to psychotherapy is happier and more satisfied with their life than 80% of people who have never gone to therapy. Let me say that one more time. The average person who goes to psychotherapy is better off than 80% of the people who don't. Why? Because we all have problems, we all have issues, we could all use somebody else's perspective and a little time to focus on our own issues and challenges, and getting that makes us better people. All right, that's it for this class. Thanks, guys. It's been a joy. Bye-bye.
That was 17 minutes.